last thing that we're going to do is just a few simple balance exercises. Now, balance is really important. As we age, we tend to be more susceptible to trips and falls. If we fall, we may fracture. So it's really important that we try to maintain our balance so that we can avoid falls. So for a few different exercises that you can do, what you're going to do is you're going to make sure that you have, again, a countertop or a chair back, or you can simply go against the wall. So the first exercise that we're going to do is we're going to do a toe stand. So you're going to start again with your feet shoulder width apart, your knees just slightly bent. We're going to make sure that we tuck our hips under and we pull our belly button back towards our spine. And holding on to a countertop or the wall, what you're going to do is you're going to rise up onto your toes, try to hold that for 1, 2, 3, and we're going to lower back down. Now as we get better, we can try to hold it longer. Maybe we can hold it for 1, 2, 3, 4, 5, and lower back down. Again, as you become more confident, you could start with 2 hands on the wall, and then maybe you just try 1. If you're feeling really confident, you can try to remove both your hands and see how long you can hold it. But always make sure that you have a surface there so that if you feel like you need to fall forward, you have something to catch you. So you can do that up to 10 times, holding for 3 seconds to start, a second, 2 seconds, however long you can. And we're just going to try to practice our balance. So we really want to make sure that while we're balancing, our bums are tucked under and our tummies are tight, and we just try to hold it for as long as we can. So once we've done on our toe stands, what we're going to try next is heel stands. So this one's a little bit different. What you're going to do is you're going to try to lift your toes off the ground and see if you can balance on your heels. So again, we can try to hold this for 1, 2, 3. As you get more advanced, we can hold it, and we can hold with 1 hand from the wall, or we can remove both hands. But again, in case I fall forward, I always want to make sure that I have a nice big surface in order to catch myself, whether it be a wall or a nice countertop or a chair back. So you want to make sure your hands are at least at hip height or higher ideally. So the wall is probably the easiest, but if you don't have a wall, you can use other surfaces as well. So we've done our toe stand and our heel stand. The last one that we're going to do is we're going to do a single leg stand. So if remember when we did our lower body exercises, we're going to shift our weight onto one leg, and again we're going to hold our tummies tight, we're going to tuck under and hold our bums tight. We're going to try to hold this for 1, 2, 3, then we can relax. Try it again. Again, as we get more advanced, we can try holding with just 1 hand or eventually with no hands. But if we have no hands, we need to make sure we have a surface in case we fall forward. So once we're done one leg, we're going to plant both feet firmly on the floor again, shift our weight over to our other leg, and practice standing on our other leg as well. So these are just a few simple things that we can do in order to maintain or improve our balance. And again, our balance is very important, as it's going to if you have better balance, you're less likely to fall. If we're less likely to fall, we're less likely to get a fracture.